Thank you to everybody for joining us today. I hope you all are staying safe and well and healthy during everything that is happening. We're really grateful to get to share some of this information with you in today's webinar on older adults in isolation during COVID-19. My name is Carrie Davis. I'm the Director of Peer Advocacy, Supports, and Services in MHA's National Office. And I will be here moderating the webinar. If you have any questions, either you're having tech issues or you have questions for Patrick, put them into the chat and I'll be able to share them to him at the end. We'll do a little Q&A, and then this webinar will be recorded. We will follow up with everybody who's registered via email and all of our social media platforms, and we'll include the recording of the webinar and also the slides for you to use and share. So now I will introduce you to Patrick Hendry, who will be today's presenter. So Patrick Hendry has worked as a mental health advocate for the past 24 years. His areas of expertise include peer-provided services, self-directed care, recovery-based training, organizational development, and management and sustainability. Patrick received MHA's highest honor, the Clifford W. Beers Award in 2012, and a SAMHSA Voice Award and Eli Lilly Reintegration Lifetime Achievement Award in 2014. He is the former executive director of the Florida Peer Network and has assisted in the development of numerous peer-run programs and organizations. Patrick is a strong supporter of the inclusion of mental health consumers in all aspects of behavioral health. I'm very excited to pass it over to him to present on older adults in isolation during COVID-19.
Thank you, Kelly. Yes, so my name is Patrick Hendry, and I'm the Vice President for Peer Advocacy, Supports, and Services at the National Office of Mental Health America. And just before we get started, I just want to comment on something that Kelly did brush on also. You know, we're all going through a lot of very serious and often difficult changes right now. Day-to-day life for virtually everyone around the world is different now than it was just a month or two ago. And it's especially difficult for some people, particularly people who face mental health problems, but also for people as they're aging and become more reliant on like personal contact and the ability to have freedom on their own, because as we get older, and I'm certainly one of those people, our lives get limited. So we're going to talk a little bit about overall mental health for older adults, and then we're going to talk specifically about some things that we can do during this time of living with the virus. So next slide, please. So, we do hear a whole lot about the baby boomers aging and the fact that physical problems, increase as you get older. Seniors often develop diabetes or heart disease, other chronic illnesses. And there's a strained workforce to serve these people that's not sufficient really to meet the needs before this crisis that we're currently in. One of the things we don't talk about quite as much as we should really is the rising number of older adults with serious mental health problems. Next slide, please. Now we're facing this whole new barrier to mental health, and that's the COVID-19 coronavirus. Older adults already face loneliness and they face isolation. And so as it becomes even more pronounced, as we find new ways to build our social lives in kind of self-imposed isolation or forced isolation due to curfews and lockdowns and social distance and all of the things that we're experiencing across the country and really across the world. And we're doing these for very good reasons. I mean, obviously, we're trying to slow down the spread of the virus, and so we're experiencing this kind of, as a nation, we're trying to step back from social contact, at least in the person-to-person sense, and find new ways of building the kind of assets that we need to go forward. we want everyone to be in the best health possible. So this presents a double-edged sword for older adults, because on one hand, they may be more open to exposure and infection than other people because of declining health in their older years and decreasing immune systems. But at the same time, they are also losing, as you get older, the losses we experience of friends and family and jobs and homes where we know our neighbors and all those things that come along with aging in our country. And now we're facing with this new type of isolation. So it's almost a question in some people's mind that they either have to give up their opportunity for physical health or their opportunity for mental health. But it's not necessarily true. Next slide, please. Self-isolation really affects older adults more than it does other groups because of the things I was just talking about, and also because a lot of people live alone as they get older. Some people move into group homes, but I've even had conversations with people in senior living facilities over the last few weeks, and they're experiencing the same type of thing because the facilities are forcing them to isolate or at least maintain social distancing. And a lot of people grow up, and I think particularly older people still feel this way, or maybe it becomes more important to us as we age, but physical contact is part of the experience of overcoming the feeling of isolation and loneliness. So for people who don't have close family or friends that they can live with during this time, and who live in that safe zone of your own home and who you can trust and rely on, now they're having to try to figure out how do we replace those type of activities that we engaged in before. A lot of people join clubs as they get older. They may become more active or have always been active in their faith community. People participate in activities that are specifically designed for older adults so that they get opportunities to meet new people. And those kind of traditional ways that we face it are now kind of being set off to the side, and we have to think in a new way. So older adults, individuals who frequently already live with anxiety and or depression, can experience a worsening of their condition. And those who haven't experienced it before are at an increased risk of experiencing it now. Next slide, please.
Also, Patrick, folks are asking if you can speak a little louder or closer to the mic.
Sure. Is this okay? Somebody type in and let me know if you can hear me now. Anyway, so, we know that baby boomers are the ones that are creating this big bump in the population of older people. And adding to the increased life expectancy of our generation, there's also the increasing of mental health problems. Older people have increased rates of respiratory and other disorders that have created, as I said before, compromised immune systems. And in 2015, nearly 57% of adults with psychiatric disorders did not receive treatment. And baby boomers are really often afraid that if they do seek treatment, that people will treat them as being different and that social exclusion will become even more of a problem in their life. They're worried that they will experience discrimination because they've always been told, my generation has been told frequently, that mental illness or mental health problems are a weakness. And as a Western culture and a developed culture, we rely a lot on independence. In fact, we kind of value independence above community in many cases. One of the things that we've learned in recent years is that cultures that rely on family connections and local community where people have close-knit connections with the people that they grew up with, and they work in the same places over their life, and they live in the same neighborhoods, they react differently to loneliness than do people who have valued independence their whole life. You know, I know when my generation started coming of age and we started moving out into the world, either going to school or into jobs, you know, we were taught often that independence was the most important thing. Well, the problem with that for people as they get older is that if those are your values, if you value independence above connection, then you're far more likely to blame yourself when you feel lonely. Whereas when people who are used to having extended family and friends and community and neighborhood begin to feel lonely, there's other assets out there for them to reach out to, and they don't feel like it's their fault. Next slide, please. So the percentage of older adults who have mental health problems isn't going up. What's happened is that for the first time in recorded history, the percentage of the population over 65 years old is rising. It rose, in 2010, it was 13% of the population, and this year it's projected to be 16%. And actually from 1970 to 2016, the average life expectancy increased from 71 years to 79 years. So what's happening is that people are living longer. So it doesn't mean that a higher percentage of older adults are experiencing these difficulties. It means that a higher number of people are older adults who experience loneliness and the other things that come along with aging. With the increased loneliness from the quarantines and social distancing and all of this stuff, we're seeing a rise in the percentage of citizens with mental health problems. Mental Health America provides a survey tool on our website, and one of the things that we have surveys to track is anxiety levels. And we have seen anxiety levels increasing over the last 2 months on a regular basis. And we can compare it to previous years or to even previous times of major issues, for instance, with the stock market or things like that. It's rising even faster than any of those experiences. And this is due to the fact that as a culture, we have not yet figured out the solution to these new problems. Next slide, please. So, you know, we can take a look at some of the traditional things that affects mental health for older folks. And, you know, we know that aging is a time of losses, as I said before. So, you know, very frequently our loved ones, you know, the people that we grow up with, our spouses, our family, our friends, they're aging along with us, and frequently we lose people. And this is, you know, as we get older, the number of losses that we can experience gets smaller and smaller. Societal roles change. You know, in our culture, we value what you do. People often define themselves by the type of job they have. In fact, if you think about it, going to a party or some kind of social opportunity, one of the first questions people ask after they find out your name is, so what do you do? As you get older and people begin to retire, or some people become unable to work any further, we have to identify ourselves in new ways. And that's not really easy to do when we've grown up in a culture that looked at us so much from our value as a worker in society. Financial security is also one of the things that's threatened as we get older. A lot of people, as they get older, their income goes down. Frequently, people have to sell the homes that they've lived in for many years and move into smaller places. They may not need the space. They may need the finances freed up from home ownership. And so all of these things contribute, again, to isolation and contribute to not being able to fully participate in the social norms that we've developed and the way that we have identified. So some of the things that, you know, people face all the time as they get older, you know, participation in meaningful activities, so work, but also, you know, as our health goes down, we may not be able to do some of the other things that were meaningful to us. We find again that relationships change and that we lose many relationships. A lot of people are not well prepared for their older years financially, and they find themselves living on the brink of or even in poverty. Physical health declines, and to a large degree, we discriminate against older people in our culture. And this is something that we have yet to really fully address. It's been a topic of discussion for over 30 years, talking about the fact that we don't value age in our culture, and that really we should, because that's traditional throughout mankind, is to value the knowledge and experience of older people. Next slide, please. So 20% of older adults may already be experiencing mental health problems, primarily depression, and that's prior to the virus. Recent research shows that depression can contribute to all kinds of other chronic health problems. Depression and anxiety can contribute to higher rates of heart disease, higher rates of cancer, higher rates of virtually any kind of chronic health condition that you can imagine. Loneliness affects us in ways that we never really knew until recent research. So in the face of these kind of imposed solutions to the virus problem and the isolation that's resulting from it, it's really critical that we now provide older adults with some new tools and some new skills and some new ideas about ways to either replace or expand their social connections. Next slide, please. One thing that we've known for quite a while is that suicide rates, particularly in men, in fact, solely for men, goes up as we get older, and it goes dramatically up from age 70 on. And as you can see in this chart, from 70 on, it's a steady increase, whereas for women, it starts going down around age 50 or so and goes to a much lower level by the time they are 85, when men are most likely to commit suicide in their life. Women are almost at the lowest point that they would even contemplate suicide. So they've all predicted that the number of older adults would increase the suicide rate, and we're seeing that. And we're seeing it now for other reasons than just aging. But as we find ourselves being more alone in the world because of the situation that we're all in together, which is kind of funny, we're in this thing together, and at the same time, in order to experience it, we have to be apart. Our workplace, like many workplaces, has gone to almost everyone works remotely currently. We already had a substantial number of people at Mental Health America who work remotely, and each of us who do that, and I'm one of those people, has had to find new ways to set up our work habits and to make sure that we felt connected to the other people that we were working with. So we're having these meetings twice a week of our entire staff, and we do video meetings because there's a certain essence of feeling more personal contact when you can see people in front of you. And we're doing this, and we're finding out that quite a few of our employees are struggling working remotely, struggling being alone, especially the ones who are completely alone, but even people who perhaps have gone back to stay with their parents, or they are married and they have a family, they're still feeling this loss of the greater connection to the community around them. Next slide, please. So with all of that said, what can we do? One of the things that we know in mental health that has proved to be very helpful is peer support. But we're struggling to figure out what peer support is now that we don't have the opportunity to have in-person support groups and in-person one-on-one peer support. We've already got people who rely on peer support either telephonically or online in different ways, but we need to expand that. And so for older people, some of these tools that we can easily use are kind of difficult for them to use. Not everyone, especially people who are maybe from 75 up, they didn't grow up in an age with access to the internet. They didn't grow up with access to computers even. And so not everyone is computer or internet literate. When available, it's really great if people have access to a new type of peer support that's really growing across the country, and that's certified older adult peer specialists. I know that Pennsylvania is one state that has worked very heavily in this area and actually have a designation. And one of the reasons why that is important is because of that word peer. We frequently in mental health, we talk about peer support a lot. It's probably one of the biggest things we talk about now, and it's expanding incredibly rapidly. The workforce of peer support workers has doubled and tripled and quadrupled over the last 10 years, and it will continue to grow. But these specialty ideas of working with older people, how do you define who is your peer? What we've had to do up till now is that the peer workforce, even though it's growing rapidly, is still limited. And so when we talk about providing peer support, we don't necessarily mean that it's going to be somebody who has the same life experience as you have, or the same diagnosis that you have, or have experienced the same kind of treatments that you have, or is even necessarily of the same racial or ethnic group or age group or gender group. So peer is mostly defined as people who have experienced a diagnosis and treatment and have some experience in navigating the system, and who have found a way in their own lives to live a meaningful life of their own choice, and we refer to this generally as recovery. And so we think that people who are in recovery can provide broad-based peer support. But if you can closely match peers to one another, the value of peer support is even greater than it is if we just do it the way that we've had to do it thus far. And I think as time goes by, we're going to see as this workforce grows, and the only reason why it's going to grow is if we start to pay people what they're worth, and we start also giving people an opportunity for a career path and the opportunity to move up in their organization or move on to other roles that utilize their experience along with the skills that they've learned through training. So peer support, it's happening. It's going to get bigger, and it's going to be something that we pay a lot of attention to. But we also have to start looking at those individual groups, and in this case, we're talking about older adults. And we're talking about them today, we know, because of what's going on. Next slide, please. So as I said before, peer support, generally it's available only through either mental health agencies or peer-run organizations, managed care companies. So the availability of peer support right now is still pretty unknown. Some organizations already provide tele-support, particularly rural and frontier communities have had to rely on that for many years. And you can contact your local Mental Health America affiliate if there's one in your area, and you can check at the website that's here, and you'll be able to download these slides later to find out if we have an affiliate. But otherwise, you can check with your mental health providers in your area to find out if there's peer support that's available to you now, where we can't, go to a place where there's going to be support. We're not, even unfortunately, for people who have relied so much on peer-run organizations and recovery centers and drop-in centers, those places, for the most part, have had to close their doors during this period because of the danger of a contagious virus. There's a lot of online support groups available. There's virtually every kind of support group you could ever think of available online. Some are good, some not so good, and we're going to talk about how you make those choices. And there's lots of different hubs where you can find out about many different groups. This is just one, Support Group Central. It lists many, many different types of support groups. And I suggest if you're not already involved in an online support group and you're interested in checking it out, that you look at a number of them before you decide where you're going to invest yourself. Next slide, please. So let's talk about what we can do for ourselves. MHA has developed a program called Peer Partners over the years, and it's been a social connections program that's been very, very effective in helping people to not only become connected with the community around them, but to build friendships and intimate relationships, whatever that means to you, people that you can rely on. You know, in the 90s, when we really first started talking about recovery, and we were just starting to use that word peer. You know, Kelly said I've been doing this for 24 years. It's actually, I think, now 29 years. And so I've seen a lot of changes take place over that time. And so when we first started talking about peer support and we started talking about recovery and all of this, we defined it in personal terms. So many of us who were running small peer-run organizations around the country got together and we circulated some surveys to find out how people defined recovery in their own life and what they felt was the strongest part of their life that contributed to their recovery. And I remember that we participated in a survey 3 years in a row when I was running an organization in Florida. And the number one answer each of those years about what contributed most to people's recovery was having at least one friend, at least one person that you could trust to have your back. And you think about that, this one friend makes all the difference in the world for millions of people right now. The goal of Peer Partners is to help build networks of friends and intimate relationships, but also to build those individual ones. And we're going to go through some of the tools that we've used and the ideas that we've developed to do this, but we're going to now figure out how to do them not by meeting together and working together as Peer Partners was originally designed to do, but to do it as an online thing. And we're right in the process of moving our program online. Positive social connection really not only, you know, makes us feel safe, it also increases our self-esteem and our feelings of self-worth. You know, we judge ourselves far too often, probably, through other people's eyes. And so our sense of self-worth is often a reflection of how other people treat us. And when people treat us as friends, we feel that we're more valuable in society, that we have a greater self-worth. And hopefully that helps us to feel better about ourselves and also to realize that we're not just receiving, we're giving at the same time. So these things are critical to a healthy life. And that has not changed, and I don't think it ever will change. People need connections. Next slide, please. So we'll go over a few steps that we can take to feel connected and all of that. But I want to talk just a little bit more about what loneliness is and what that experience is for most people. There's been some research done in recent years, and one of the things that came out of the research is that when people experience really major loneliness, and they've experienced it on an ongoing basis. And recent surveys have shown that up to 46, 47% of U.S. citizens experience the feelings of loneliness on a regular basis, and a very high percentage experience it much or most of the time. Same thing is going on in Europe. There's been campaigns to try and decrease loneliness in our society, and now we need it even more than ever before. So one of the first thoughts about what can you do for yourself is certainly to reach out before maybe you were able to meet a friend at a social center or go to their house or meet them for a meal outside. Well, if you have those friends, reach out by phone, through social media, use video calling. Again, when you can look at somebody and see them face to face on the screen, that's better than the total isolation, and it's even better than just being able to communicate either through social media or through these online support groups. Personal contact is extremely valuable, and it's precious to all of us. We're social creatures, and our brains are hardwired for social connections. So during these times when we can't use our normal means of contact, we have to find new ways. And as I said before, for a lot of younger people, this is already a major way that they connect together, is through social media or through online gaming or through all kinds of different online communities that they may be a part of. But for older folks, it's a skill we need to learn, but it's a skill we can learn. It's important that we try to set up regular communication because in a time of uncertainty, having something that you can rely on, something that you can look forward to on a daily basis and maybe multiple times a day is really comforting. And comfort is something we're lacking right now. Most people are, to a degree, they're afraid of the virus. To another degree, they're afraid of the isolation. And when you put those two things together, the fear factor goes up tremendously. But if we can even mitigate it a little bit by having some kind of ongoing regular communication with somebody that we care about or whose opinion we care about or who just is enjoyable to be in contact with. Next slide, please. If you're a person who's relied upon religious organizations or gone to like social centers or any other type of social connection, getting together with friends on a regular basis, if that's been an important part of your life, you can call those organizations. People right now can't maybe attend church, but they can call their church, and many groups like faith-based organizations, social centers, mental health agencies, clubs, all those things that we might have experienced in person before, if we reach out to them, many of those organizations are setting up new mechanisms for people to stay in touch because they realize how important it is. And it's also important to the organizations in order for them to survive this. So if you feel like you don't have those kind of relationships, you can rely on begin to rely on some other ways of building new ones. So sit down and make a couple of lists, some very simple lists. For instance, what are your interests? What do you like to do? What do you do for fun? What type of people are you most comfortable with? And do you think that the type of people that you're comfortable with are the type of people who might be interested in similar activities to you? If so, there's opportunities for connection there. Next slide, please. So at the same time, when you make these lists and you start considering these options that may be available, make a list of what you feel are your social strengths. I mean, for instance, are you a person who's comfortable meeting and talking to new people? Is making conversation easy for you? Do you feel that other people find you interesting? But then also make a list of the things that are difficult for you. Some people are very shy, and having a conversation with a stranger is extremely difficult. Some people are afraid what other people will think of them, or that they won't think that they're interesting, and they fear rejection. We're going to have, starting next week, a list of some opportunities for people to begin doing some skill building exercises that will allow you to work on those areas where you feel you have the greatest needs to be able to reach out. the purpose of doing all of this is, how do we make friends in society? You know, as children, we make friends at school or in our neighborhoods. As we grow older, sometimes it's through work. That's probably the most common for adults. Or we do it again, maybe through our children's connections or in our neighborhoods or through our faith-based organizations or other kinds of groups that we join. Right now, many of those opportunities are not available to us, but there are similar opportunities available online. So if you can figure out something that you enjoy, perhaps it's gardening, perhaps it's skydiving, whatever it is, you'll find somewhere on the internet a group of people who like doing similar things to you. And so we're going to talk about ways to utilize those assets of the internet in a way that's not only fulfilling and makes us feel better about ourselves and makes us feel more connected and less isolated, but also how we can do it in a safe way so that we're not putting ourselves at risk, particularly for those of us who aren't really familiar with this alternative way of meeting people. Some of the skill sets that we have assets for, some building things, are things like communication skills and how to build healthy friendships, coping strategies during times of stress, and expressing your emotions in a healthy way that's productive. Next slide, please. And so we also have things on, for instance, for some people, it's really difficult to ask for help. And yet right now might be a time where you need to ask for help. You may need to ask people to join with you in some way. And so we have tools that you can practice on your own. You can practice with a friend if you have a friend you can talk to about these things. But you can learn to overcome almost any of these things with enough practice, and then with practice, just slowly implementing these new skills in a way where you're not risking everything, but you're trying a little bit more each time, because one of the things that we do know is that small successes lead to greater successes, because as we succeed at our smaller goals, we're willing to take bigger risks to achieve greater goals. One of the things that you'll need to do is learn to use the internet if you're not already using it, and learn to search the internet. And so next week we're going to put up some links about ways to search the internet and ways to find groups that might be of interest to you, and ways to join groups in a way that is not so scary, not so overwhelming. You know, when you try to take on too much at the same time and you're already in a state of anxiety, it becomes even more difficult. And for those of you who are on this webinar today who are peer support people, or perhaps mental health professionals, or people who work in some kind of social programs, you can take these ideas and help the people that you work with expand on them. You know, it's a time for each of us to reach out. And so we reach out not only to find the connections that we personally need, but we also need to reach out to offer those connections to others. And that gives us an even greater sense of community. You know, that's one of the things that we know is true. We're all in this together. And many of you, if you watch the news, have seen some of those scenes from, for instance, in Italy, where there'll be blocks of apartments and people will come out on their balconies or come to their windows, and they all sing together in the evening. And you can just tell that's a community. Those people have connected in a way that they probably never connected before. And other things like this are beginning to happen. You know, my son works for a software company, and they have their regular meetings online, you know, and this is all very simple for them. But since they've all started working remotely, one thing his team does is every day they get together and have lunch together. And it's video connections, and everybody has their lunch right there, and they just talk. It's not about work. It's not about anything specific. It's an opportunity to just kind of socialize, because you know if you were at the office, People walk around the office, they talk to people, they ask them how they're doing, ask them what they're going to do over the weekend. So you don't want to lose that, and so we need ways to recreate that. So not many of us live, I think, in neighborhoods where people are going to lean out the window and sing, perhaps in some of our urban centers or possibly in other places. But you can see some of the things that people are posting. I saw last night on the news where there were these groups getting together, and there were maybe 100 people on screen, and they were all singing the same songs together. And so they were recreating what was being done in person in Italy. They're recreating it online. And so things like anything you can do like that. Our office has started a virtual happy hour on Friday afternoons, evening. At the end of work, everybody gets together and sits around and chats and talks in a way that, takes you away from the worries of work, but reconnects you as a human being. So we need to learn to use these tools, and in order to do it, we have to find out what's out there. And so learning to use search engines and other ways of connecting to assets is really important. We're going to post some links to resources that can also help you with internet safety. If you're not someone that has utilized the internet or utilized social media, there are risks out there, and there are always people who are willing to take advantage of any situation. So there's some, common things that we can think about where we don't risk, like personal information, we don't risk financial information, we don't just blindly click on a link because it's there and maybe it'll take us someplace interesting. And so this may be just commonplace to everybody on this call, but it may not be to the people that you're working with. Next slide, please. So as you do these searches, begin to make a list of where are we? Okay, make a list of interesting groups that you find, and then you can start looking at them online. And you don't even have to participate. You can go online. So a lot of the support groups, they'll give you a lot of information. They'll even show you demos of how it works and all of that, so that you can make a decision about which group you're going to invest your time in and your hopes too. And that's a big part of it, is that we do this because we hope it's going to improve the quality of our life. Then sit down, and maybe you've made a short list of the groups. Make a plan. Make a plan about how you're going to engage in those groups. So first thing you want to do is figure out what are your expectations if you go online and go into a group where there's all of these strangers that you don't know. And particularly with the support group models, people are frequently talking about things that are very personal in nature. And so you're risking something every time you join. It's the degree of risk versus the reward that we need to take into consideration. If you're new to online groups and you're not sure about participating, you can just go on and listen. And you can listen to what other people say or read if it's that type of a group or everything. Most of the online support groups are written groups. So you can see what other people are saying before you ever risk your own personal, invest in it personally in a way or emotionally. You can also get a feeling for the personality of the group. And a good example of that is for people who participated or still participate in 12-step programs like AA. You can go into almost any town, probably any town in the United States, and there'll be an AA group. There'll probably be multiple groups. And one of the things about AA groups and those type of 12-step programs and some other programs is that they each have a distinct personality. And it comes from the kind of joined energy of the people participating in the group. So I have friends and family who participate on a regular basis in 12-step groups, and when they go someplace new and they want to go to a group, they go and try one out. But if it's not a comfortable fit, they go to another one. And that's what online support groups and these other type of connections allow us, is we can kind of get our feet wet a little bit, find out what the group's like, find out if it's comfortable and it meets the needs that we're trying to achieve. Then when you start to feel comfortable, you can begin to increase your participation. You might want to just, comment on something that someone else said. You might want to maybe say something that's to a degree personal, and then you see the reaction you get, and then you see whether that makes you feel good or it makes you feel uncomfortable. And you can keep looking until you find the one that's going to work for you, or it may not be one. It may be a multiple amount of groups that are a good fit for any individual. And don't forget, just because you join a group, and maybe you have to sign up, most support groups you do, you have to kind of sign up, and some of them cost money, and that's a decision individuals have to make, but there's plenty of free ones out there. But when you join a group, you don't have to stay with that group. There's nothing that controls that. And if you're uncomfortable, then step away and look for something else. And look until you find what meets your needs. Next slide, please. So, being alone physically, as we are now in this kind of self-imposed isolation that the world is experiencing, doesn't mean that we have to be alone socially. A lot of people have developed their closest relationships through social media. Some people, that's the main way that they're in contact with others. For people who haven't done that, it may turn out to be of that kind of value to them. There's millions of people who are having to find new ways to connect and to overcome the losses that we feel because of this experience that we're all going through. With these losses comes new opportunities. People are trying new things, and it may be that our world going forward is going to be altered forever, perhaps, and it may be that our personal world is going to be altered, in that we have found new ways that we're comfortable with to be active, to interact with other people, to feel supportive, sometimes to feel loved. Celebrate each new step forward that helps you feel connected or achieves what you want. And just keep in mind what I said before, even small successes, going on that support group and the first time you type in a thought, maybe reveal just a little bit about who you are and what you're feeling. And then nothing bad happens, it's a success. And that leads you to type in a little bit more and perhaps engage in the conversation even more. So these small steps are what's necessary right now as we try to figure out this new world and we try to figure out what our place is in this new world. Next slide, please. As I said early on, loneliness hurts, and it literally hurts because we experience, as I said before, loneliness in the same centers of our brain where we experience physical pain. And that's because we are hardwired for social connections. So it can feel overwhelming to try all of these new things, and nobody needs to do them all at once. Go at your own pace. And I do really suggest that each person and the people that you're working with and trying to offer new tools to, tell them to go at their own pace. Tell them to sit down, and if they're somebody who likes to write out their thought, make lists of things they like, make lists of things they don't like, make lists of the type of people they like to be around and the type they don't want to be around. Make lists of anything that might lead you in a direction that gives you what it is that you're seeking. Don't accept that you have to be alone, and give that message to everyone you work with. People need to reach out. We need to let other people know that we want to be a part of what's going on around us, that we want to be a part of this new world that we're in right now. And next slide, please. So I like this, this quote from C.S. Lewis. You can't go back and change the beginning, but you can start where you are and change the ending. So none of us can go back and change what's happened that's brought us to this place that we're at right now, but we can figure out how to move forward. And it's not hopeless. No one needs to feel hopeless. The world that we live in now is offering us more opportunities for connection than has ever been possible throughout the history of mankind, because we still, will have eventually, as the fear of contagion begins to go away and people are able to have personal contact again, we'll still have those communities, those neighborhoods, those personal friends, those churches and mosques and temples that we attend that makes us feel part of a community. All of that will still be there. And now you will have added to it. And so you will have written a new chapter in your life, and you'll find that by doing it, you feel better, you feel stronger. And I can truly say, as someone who is getting along in age and just starting to realize that I'm actually an old man, finding new tools to connect with people has been really important to me personally. And I think it's important to almost everyone. And right now it's even more important than ever. So I'd like to take some questions, and Kelly will read them out to me as they come in if we have some.
Awesome. Thanks so much, Patrick. This has been really great, and it seems like the folks in the chat box also agree that this has been really helpful and useful information. I have some questions that folks have been asking throughout, but if you have additional ones, we have about 8 minutes left. So if you have additional questions, feel free to drop them in the chat still. One of the questions from earlier in the presentation was, how do people get access to older adult peers?
Well, they're not really common around the country. This is relatively a new area. There's been some places in the U.S., particularly around the Philadelphia area, actually, where Kelly is right now. They've had older adult peer specialists for a while, but it's a new idea. One of the things we see when we look closely at who's in the peer workforce, it's still heavily weighted to older people because they got involved in peer support a long time ago and they've stayed with it. So we're a little bit weighted to older people, which lends ourselves to providing peer support to older adults. The only way you can access it, I think, is to contact organizations where you live, contact mental health organizations. If there's peer-run organizations, contact agencies like Mental Health America or NAMI or DVSA to try and find out what's available near you. But also, I think we can begin to look for, and it should be appearing. I did a quick search today and didn't immediately come up with anything, but I think we're going to be seeing more and more older adult peer support available online. Kelly?
Yes, sorry. Can you hear me?
Yes.
Okay, great. So another question is, what can we do to provide peer support to older adults who do not have internet access?
This is difficult. It really is. And, if you're someone who provides peer support, you can certainly reach out to people through the telephone. For years, that was the way that we did distance peer support. I did a lot of work even just like 10, 11 years ago in some of the frontier states. I remember working in Montana, and Montana is one of those places where it can be 100 or 200 miles to the next major town or city or the next mental health center. So they didn't have always the availability of face-to-face peer support. And at that time, the digital divide was much greater than it is now. Most people now, many people at least, and most people I think, have smartphones, which gives you some some access to this. People need to learn to use them, but also people they have telephones. And if you're a peer support person and there's somebody that you've provided peer support, perhaps one-on-one or in a support group before, reach out to them by telephone. See if you can set up just a regular call. Any kind of contact is a benefit.
Awesome. Thanks, Patrick. Got a couple similar questions from folks who are concerned about the immense potential for exploitation of older adults on the internet, especially during this time. Do you have any resources or information that will be helpful for people concerned about that topic?
Yes, we're actually just in the process. We've had this Peer Partners program before, and we're now taking it online. We're going to be coming out with most of our tools and our links and everything at the beginning of next week. But you can, even on your own, as somebody who provides support and is trying to help people stay safe, you can find some reliable safety rules online. You can review them for yourself and understand and be sure that you feel they're safe before you recommend them to somebody. But there are many things that people can do to stay safe. One of the problems that we've experienced since the beginning of using the internet for support groups was always that person who comes on, or those people that come on, the trolls, the people who are there to stir things up, often to actually create damage to other people, and somehow they feel better about themselves by being able to hurt others. If you're a person who goes on these groups and you experience any of it, report it. If it's still there, I would leave that group. We don't need to be making ourselves available to negative influences. We all know that, seniors frequently have been taken advantage of over the years, either through emails that are phishing, to try and get you to click on a link. Now text messages, same thing, scams that come in the mail, all of that stuff. And as you get older, perhaps you're not quite as sharp. Perhaps it's just that you're not as up to date on the next type of scam. But we can learn about them, and you can help the people you work with to learn about them. And you can learn about them for yourself at the same time.
Awesome. All right, so it looks like you have time for one more question. So final question, Patrick. And then for folks who can see the screen, Patrick is available by email. That lists his email on the slides. And then this information, the recording and the slides, will be emailed to everybody who registered and will be available on MHA's website. But the last question is, how do you help people who are reluctant to reach out or ask for support?
And that's not unusual. It's really quite usual, because a lot of people who do feel isolated, it's because they are reluctant. That reluctance usually comes from fear, from feeling overwhelmed, being afraid to engage in something new that you don't fully understand, being afraid that you're going to make some sort of mistake that people will judge you by. If you work with people that maybe experience this, and I've run support groups over the years, and it's been difficult frequently for people to even attend one meeting of a support group because they're so fearful of how people will react to them, or they're even afraid of going out. You have to work with each person individually. We're all different, and we all have things that feel safe for us and things that don't feel safe. I think, peer support is all about meeting the individual where they're at. So that means that each person is unique. And we as peer supporters, or people who provide some sort of support, we're obliged to help people work through those issues, to expand as much as they can, to not push them to things that they're not comfortable with, to try and get people to take little tiny steps, because as we said before, little successes lead to bigger successes in the future. So if people are fearful of this, it's not unusual. Anxiety is already at a high. It's going to be hard for people to try these new things, but it's there. and we don't know how long this situation is going to go on. The longer it goes on, the more important these kind of connections will be. So work with people as unique individuals and try and help them to take whatever steps they're comfortable with.
Awesome. All right, thanks, Patrick. And again, thank you all so much for attending. It's been great to see how helpful folks have been to one another in the chat box throughout the webinar. Again, the webinar recording and slides will be available. If you registered, they'll come directly to your email, but they'll be available through MHA's website as well. As a heads up, we'll have a link set out tomorrow. We'll be having a webinar on Friday on updating routines and goal setting during COVID-19. And we'll be continuing to have sessions like these, at least for the foreseeable future, to provide information and connection for folks. And that's it. Thank you all so much for joining us. Again, my name is Carrie Davis. If you have any questions, feel free to email Patrick directly or myself. And hope you all have a safe rest of your day.